All right, welcome everyone. My name is Don Neese. I am the Director of Community Engagement at CCTSI, and I appreciate your taking time on a beautiful fall day here if you're in Colorado, to sign into our Community Engagement Forum. This is a joint project between the CCTSI and Accords, and we're excited to have today, our topic is ethical data practice from storage to sovereignty. And this is a part of our series that we're doing this academic year in ethical practices and community engaged research. If you're a newcomer to our forum, just as a bit of orientation, we think of this as sort of a appetizer or maybe an amuse-bouche for community engagement work. Um, if you're interested in digging in more, we encourage you to contact us. We have a no wrong door policy. You can reach us either through Accords or CCTSI through links on both of those websites. So we look forward to hearing from you if you want to dig in more around the work of engaging communities in research. So just a teaser about our next date, which will be January 28th. And then our third annual in-person forum and networking session will be on April 24th. That's always a really great session where we're able to actually meet in person and bring in some of our community partners as well. So let's dive into today's topic. Again, we're talking about ethical data practice from storage to sovereignty. And we have some great panelists for our discussion today. We're going to be looking at data and the ethics around that in a couple of different perspectives. And, oftentimes when we're talking about engagement, we're talking about from the perspective of community engagement, community engaged research. Today, we're also going to be talking a little bit about what does it mean to be engaged in research. So watch out for that nuance. Um, Again, we're welcoming folks today, partners that have worked with us on a variety of projects in the past that have various backgrounds that can really help cover this from multiple perspectives. And we're going to be talking about all of this in the context of our Colorado SEAL work. Our Colorado SEAL project is a NIH-funded Community Engagement Alliance, that's what SEAL stands for, project, working in 5 different partner communities here in Colorado. And we've been doing this work in these communities since the pandemic, and it's been a really fantastic work and ways to engage our partner communities to help address issues around disproportionate impacts on their health. So just to briefly introduce our panelists, first we have Allison Lakin, who is our Associate Vice Chancellor for Regulatory Compliance on our CU campus. Next, we'll hear from Zach Giano, who is a research associate data scientist at the School of Public Health and Center for Innovative Design and Analysis. And he's our lead statistician on our COSAIL project. And then finally, we'll hear from Charlene Barrientos Ortiz, who is a community research liaison with our CCTSI Community Engagement Corps, and also a senior research services professional within the School of Public Health. And Charlene is our community engagement lead for our COSAIL project. So with that, we're going to dive on in, and I'll pass the baton to Allison to get us started.
Okay. Thanks, Don. Appreciate the opportunity. As Don mentioned, I've been asked to talk about data. I'm coming very much from a regulatory ethics perspective, to really help make sure that we are using the similar language, because there is a definite framework. Are my slides correct? Yep,
Yes, they
okay.
are, Alice.
Okay. And so my goal is really just to make sure we're talking the same language or similar language, because unfortunately in this arena, the language is important in terms of what it triggers regulatory wise. And so that's my perspective. So I'm going to hit some of the key regulatory definitions and talk very briefly about what the impact of that is for collaborative work with the community, and then just to kind of tease a little bit around how do we make sure we're still doing meaningful community engagement research within this framework. And I get asked a lot of times, why is there inconsistency in approach? Or why does the answer to kind of how we use data, how we think about data change when people ask specific questions? And that is, I think, for a number of reasons. One, each research project is different. Interpretation of regulations can vary depending on which institution you're working with and the setting of that institution, whether it's an academic institution, it's a community institution, same regulations may not apply. Things keep changing, both technology, how we collect data, how we use data, what the regulations say changes. And experience of how to interpret regulations can vary. And so people can get a little rigid if they're not comfortable in that environment within which they're working and not understanding where the flexibility is. So my goal today is to really help to facilitate that conversation about getting a shared understanding of what data is being collected, what the parameters potentially of that data are. So one concept that you will probably hear, particularly from the academic partner side, is that there is a role for what's called the Institutional Review Board. In some countries, that's called the Ethics Committee. So you'll hear it referred to in different ways. Locally, you will hear reference to COMERB. COMERB is a specific IRB, but we use lots of different institutional review boards, and the role of that board is it consists of scientists, non-scientists, researchers, non-researchers, and community members, and it's just a second pair of eyes to make sure that the project that's being proposed is being conducted in accordance with the applicable regulations and is looking to ensure the safety of the individuals involved. And when we're talking about data, that really is thinking about the privacy and the confidentiality of the data. It is specific. It is required of institutions that receive federal funds. So if you are working community partner to community partner, these regulations may not apply if they're not receiving federal funds. And so that's why you may see a difference when you're working with an academic partner that is taking research funding from the federal government, then these regulations flow through. So that's one of the things that can lead to kind of a difference in approach depending on who you're working with. Don mentioned this within that regulations over the purview of the IRB is this notion of engaged in research. And And it's a very specific regulatory definition of engaged in research. That doesn't mean that there isn't a collaboration partnership with community and the academic partner. It means, do these regulations that are triggered through the IRB, do they apply to you? And so that's where we get to. And it really depends on exactly what the role of the people who are involved in the research study are actually doing. And so that's where you'll get questions about probing, as a community member or as a research, it can be on either side. Are you actually interacting to obtain data for research purposes? So that can be conducting a survey, actually doing the data collection. It could be facilitating the focus group. It could be providing, I say, that interaction, that intervention to record the data for research purposes. Or it can be where this gets, it can be that you have access to identifiable data. And we'll get into what identifiable data under the regulations means in a second. And one of those research interactions that is specifically called out in the regulations is whether or not the community partner is going to be involved in the informed consent process, which is a requirement under the IRB regulations. If those things trigger, then you're engaged in research and these regulations apply. If they don't, though, there are a lot of collaborations where we don't trigger those regulations, but the community partner is still actively engaged on a level in research, just not triggering the regulations, if that makes sense. And so that can include recruitment activities. It can be the use of space in the community, can be participating in the design of the study and having feedback and input into that study design. It can be conducting activities that were not being done for research purposes, but the data is being collected. So it can be the community partner is having its regular event and there is some data that's being collected, or it's being observed and data is being collected around it. Or we get into there's a ways to de-identify or have coded access to data that doesn't trigger the regulations on aggregate data results. So we'll talk a little bit about what those are. The other piece is, if you're not wanting academic credit, you can be involved in the writing of the paper and sharing of those results too. So there's a lot that can happen that is, in the broader sense of the word, how the community and the academic partners connect. And we use community engagement as part of that language. That is different from, are you engaged in research for regulatory purposes? And so, and one is not, in fact, if anything, it just is more onerous. There could be good reasons why it's important that all parties involved are fully engaged and completely viewing themselves as equally responsible under the regulations. And there are going to be other times where it's less onerous for the community partner to try and avoid being connected. It tends to make more sense if it's a long-term relationship, because it's more onerous. I'm just going to say, unfortunately, rules come with responsibilities, and that they tend to be a little bit more prescriptive as to what is required. So one is that everybody who is engaged in research is under the jurisdiction of the IRB, which means that they have to have training in the regulations around research and data. And so that's the other. So there's a training requirement. There's also a requirement to ensure that they fully understand the protocol, the consent as it's written, and that everybody's agreeing to follow that protocol and not deviate from it. And there can be audit and compliance requirements that go with that. So it's something to just to think through and make sure you know which direction you're going in before the study starts, and you give time to actually be able to either meet the requirements or to understand how you're going to avoid those requirements. When we talk about data, we talk a lot, there's a lot of jargon. And as I say, it's all it's got very specific regulatory definitions. As an academic health science campus with our clinical partners, both in the hospitals and in the clinical healthcare setting, whether that's PCP practices or we think a lot about HIPAA, and the academic researcher is going to be very focused on the regulatory requirements around HIPAA and HIPAA data. But HIPAA only applies in that hospital clinic setting. And so I think sometimes it can get over applied when we're talking about community. So in the healthcare setting, we're going to talk about protected health information, which is really just saying that there is data that identifies an individual, whether that's their name, their address, their medical record number, different numbers that are unique, that connect to you as an individual, plus some level of health information. And that is what we call protected health information, and that falls under the jurisdiction of HIPAA. You may also hear the term limited data set, and a limited data set means that some of those names and addresses have been removed to try and protect privacy, but there are still dates, particularly birth dates and zip codes, that in theory, with the right other connected information, can still identify you. There's more, it's there to protect privacy and to give some more flexibility, but it does still trigger the HIPAA regulations. You'll also hear the word coded. Coded data means that there's a code that links the data that you're seeing with that those identifiers, and that is more secure. It still has a little more flexibility in how we can potentially share that data, but it's going to fall under HIPAA 2 only when we get to de-identified data, where there is no names, addresses, no birth dates, no zip codes, no other identifiers. Are we really in data set that HIPAA doesn't apply? But I would counter, as I say, that a lot of even if you're collecting, if you're going to a church and you're asking people for their, asking them if they have diabetes, that's health information, but it's not necessarily subject to HIPAA. So I think we've got to get very clear on exactly what data we're collecting, where we're collecting it, which regulations apply. There are other data terms that I think are important to bear in mind. The notion of aggregate data, which is summary data, so we've done some level of analysis or pulling together individual data sets, that is more easily shared because there's less privacy concerns. even if HIPAA doesn't apply, I do think it's important to have conversations about personal data, what personal data is being collected and why, and how you're going to share it, use it, store it, manage to it, because people can get very sensitive about, and people have different ideas and thoughts about what they consider personal data. And so just again, even within the broader context, I think it's important to think about that. And even more so, kind of having conversations about what are we calling sensitive data, because just because HIPAA doesn't apply doesn't mean that we wouldn't want to be thoughtful, respectful, clear on how we are using people's sensitive data, personal data, in a particular study, because I think it's important that we've all agreed up front, and that what we think of as sensitive data, community partner may have a different idea of what is sensitive data, and there's individual sensitive data, and there's data that can impact a community, and so thinking broadly about what we mean by data, and having those conversations, I think, is really important. There are questions, and you're going to hear more about, the difference between data ownership, data stewardship, and data governance. And I, I can give you the data ownership bit, at least legally. The individual participant who signs and agrees to be in a research study signs a consent form and authorization, if that's applicable. Under authorization is a form under HIPAA to allow access to their data. They retain the rights to that data and can withdraw their consent and authorization at any time until it becomes aggregated to a place where we can no longer kind of tease that apart. But there's always the underlying governance and ownership belongs with the participant. Federally funded research technically is owned by the institution, and that can seem daunting. The other way to think about it is it means that it's not owned by the federal agency that is funding the study. So it gives the institution and the community partners more opportunity to have the conversation and the flexibility to talk about data governance, and not to be too focused on the ownership, because there's a lot more flexibility if it's connected to the institution. Industry funded research usually is the data is owned by the industry sponsor that is funding the study. So it's important to be aware of what your funding source is for the research study, because that might have parameters. But I think where we all are not doing as good a job as we should is actually spending more time thinking about data governance and what that framework is for how we're going to think about data management, what those principles are going to be, what that collaboration can look like, and who is going to be responsible for what. So your data stewardship is actually who are the people who are going to ensure that the data governance is carried out the way that all parties have agreed to. And we don't spend enough time there. So it's complicated. There's a lot of jargon. There are a lot of parameters around what we can do. And whenever I get questions about what we can do in a study, I'm always going to say it depends, because it all depends on the specifics. But and I do think that what you'll find is that there's a general sense of uncertainty, maybe not fear per se. It's Halloween season, so I would kind of go to fear, but it's really does, there can become a rigidity to ensure that we're complying with the regulations that I think is unfortunate, and is not the way that we have to. We can work more flexibly if we want to. There are limitations of time and money. And I would say that I think that it's really important to know what the data set is that you're going to be collecting early, so that you can think about what regulations apply and how you're going to frame your governance structure. And that is work that the more you do up front, the less problematic it can all become on the back end. And be clear on communication, which is tied into the time and money. Everybody wants to start collecting data because it feels like you're moving forward. But if you really don't have a good plan of what you're going to do, you're going to just create more problems in the long run and not be as thoughtful and strategic up front. And please, there are plenty of experts in the regulatory landscape who can help problem solve, and help set those parameters for the work that you're looking to do. So don't get lost in that. Researchers never like to know that the regulations are the floor, they're not the ceiling. So just because you can do something doesn't mean it's the right thing to do. So again, it is making sure that everybody is agreeing on what's the best way of managing that data, connecting to that data, who has access to it, where it should be stored. I think are all things that there's a lot of opportunity for. And that's where I'd say there's a lot of flexibility to do the right thing. But it takes time. And all the IRB is doing is approving the proposal that the research partnership puts forward. It is not the one, they are not the ones who are prescribing what that should look like. They're there to ensure that it meets that floor. If you want to go above that, they're not going to say, no, you can't go above it. They just want to know exactly what you're going to do. So again, that just leads you to, having that, planning your data storage, your access, your dissemination early is going to be my recurring theme here. If when you're doing, so really when you're thinking about a research study, plan early and budget thoughtfully to know where you're looking to go. And I think part of that is really then this partnership and trust on all sides to make sure that we are protecting the privacy and confidentiality of the people who are trusting their data to us, in a way that makes sense for everybody involved. And the clearer that plan is, it can tweak over time, but it's really important to have that clear understanding up front, and to understand the study design and the timeline for actually how long all of this is going to take and who's going to be involved and who's collecting. The consent and authorization should clearly lay out who is going to have access to that data. Make sure that everybody is involved in these conversations early and continuously, because research changes over time. What you think you're going to do and where you end up can be in different places. Sometimes that requires an amendment just to make sure that all the paperwork and everybody on the IRB and all the partners are on the same page. But really think about what your data governance, your dissemination plan, and what that long-term data storage is going to be, sooner rather than later.
Allison, I'll just note that
and part of that is your dissemination of results. And I did green, yellow, and red. I think we do a pretty good job on the green and we do a really bad job on the red, which is is sharing more broadly study results in a way that that people can relate to it. So that would be my kind of push to try and get us actually really thinking about dissemination. So that is the context within which then I think Zach is going to, oh, and I will stop sharing would be the other thing that I need to do.
Transition over, and we're really excited to hear a great example from you, Zach.
Great. Yeah. Thanks, Allison. Appreciate that. Let me just share my screen here. Okay, so I'm going to be talking about a project we're titling the COSEAL Community Paper, with a quick shout out to some of other my colleagues on here that are involved in this work. Let's see. Oh, next slide. There we go. So COSEAL stands for, just a quick primer on COSEAL. COSEAL stands for the Colorado Community Engagement Alliance. And it's a partnership of a few entities here. One's the University of Colorado. We have some community organizations and some local statewide leaders. The overall mission is really to address health disparities through community-driven engagement and research participation. And we do this in 5 different communities in Colorado. 3 are urban communities and 2 are rural communities, with each community having sort of a different racial ethnic makeup. And I should note, this is founded by the NHLBI as well. And I believe someone put in the chat, there's a link for if you want to do a deeper dive into COSEAL. Okay, so the one of the main things I've been working on lately, there we go. Okay, is a COSEAL community paper. So the main goal of this is to take some data analysis, to write it up, submit and publish a manuscript with COSEAL results. This is sort of the bread and butter of what we do in academia, but the cool thing here is that we wanted to do this in conjunction with COSEAL community partners. So this is everyone from data collectors, community liaisons, CU academic partners. You know, traditionally, I think in academia, what we do is, you know, we get data from wherever we get data from, we analyze it, and then, you know, a few people will collaborate within academia, which is still a process to do, but, you know, we assign certain sections, collaboratively write a paper, and then submit it. We wanted to do this differently. We wanted to do this in conjunction with everyone on the continuum in COSEAL if they wanted to participate. And so this is sort of the model that we followed here. So the very first thing we did is the evaluation team, which I'm a part of. We ran a couple of initial ideas. We wanted to make sure we had something solid before we presented it to the community partners. So we ran those analyses. We got approval by the internal COSEAL team. And then the next step was we emailed our community partners, and we did this with an initial email, and it had a video explanation of everything that we're doing. You know, with the big caveat here that a lot of the people that are involved in COSEAL are not involved in academia, and so they're not as familiar with the manuscript writing publishing process. And so I wanted to pause here on the model. This is model part 1. I'll get to model part 2 in a second. Just wanted to show some examples of what this initial email sort of explained. One is we explained what the manuscript process is like. When you get data, you write a paper, you send it to a journal. One of the few things the journal could do is they could just flat out reject it. If that happens, we go back to the drawing board, maybe edit some things, we could change some things, and then we can send it back to another journal. Eventually, fingers crossed, that journal will give something called an R&R. It stands for revise and resubmit. So that's when the journal says, we really like your paper, but we want you to change these 18 things. Sometimes it's very little, sometimes it's a lot of changes. And then we make those changes and then send it back to the journal. So we wanted to explain, essentially, this is, a lot of times it's academic publishing is not a very straightforward process. It's not you just send it and accept. There's a lot of back and forth. So we really wanted to prepare them for what the process was like. The other example is, and I know not everyone's a statistician, so I'm just going to very briefly go over this. This was our paper idea. And really what you can read from this is there's two outcomes that we had from our data. One is testing rates for COVID-19, and the other is vaccination rates for COVID. And how you would read this, there's two important numbers on here. The first one is this 1.969. Essentially, how you read this is those who saw COSIL's campaign messaging were almost twice as likely, 1.9 times as likely, to get tested for COVID-19. The other outcome and the other number is 2.4, and you read this in the same way. So those who saw COSIL's campaign messaging were almost 2.5 times as likely to get vaccinated for COVID-19. So, we have some really promising results. And I'll also say here, for those who didn't necessarily want to get involved in the paper, it was still really cool for people working on the ground level in COSIL to see some of these results. I think a lot of time there's this big gap, universities and academia, we collect all these data from the community, and there's no sort of dissemination back and forth. And I think sometimes a lot of communities are wondering, like, hey, what about all those surveys and all the data time we spent, collecting all of that? They probably just think it goes into an abyss somewhere. And this was at least cool. If they didn't want to get involved in the paper, we could say, these are some meaningful, real results that we gleaned from the data that we collected. So going back to now, so after we sent that initial email, we had several community partner meetings. So we said, if you're interested, here are a couple of topics that we think would be meaningful parts of the paper. So if you want to get involved in that, we're happy to have a meeting. So we had a couple of meetings. And then after that, we developed some bulleted notes. And then we sent those bulleted notes back to everyone who was at the meeting. And, we asked them, do these look good? Did we miss anything? Is there anything here that shouldn't be included? Any edits that you want to give? And then after we got that feedback, we turned those bulleted notes into formalized written sections, sent those sections back to everyone at those meetings, and we asked the same thing. How does this sound? Does this capture everything that we had in the meeting? Is there anything in here that's misrepresented or doesn't sound right? And then the next step, which is the step that we're currently on. So we've gone through this whole process. And then the step we're on is formalizing the manuscript. Once we're done with that, there are some parts we're going to write, some of the methods and results that are a little more statsy and more suitable for people in academia. We're going to send that back to the partners for review, have them look at the whole manuscript. It was interesting. We just sent an email about the title. I know that's like, just a small piece of the manuscript, but it matters. And we wanted them to be able to, this is their data, and we wanted them to be able to get a say in, what this is. And I think it's pretty neat that they'll get authorship, fingers crossed, once this is published. So this next slide has a lot of words on it. Don't read it. It's a funny thing for me to say, but I just wanted to give you an example of sort of what the raw data look like. So after one of the meetings, we just wrote down everything anyone said. If someone piped up and said, oh, I had this experience, or I thought this was important, we wrote it down. Same thing about this next slide. Don't read, just to give an example of sort of what this looks like, getting your hands dirty. We then took all of those just notes, and this is what we sent back to them. We sent back bulleted points, a little bit more organized. And again, we asked them, how does this look? How does this sound? Did we miss anything? And then from those bulleted points, this is where we get some of the pieces of the manuscript. And these are the more formalized writing sections. So you can kind of see the flow in how it goes from a meeting where people can just pipe up and give their experiences, that to a formalized written section in a manuscript where their voice is represented here. So some challenges with this. The process is much slower. Publishing a manuscript is not a quick process in and of itself inherently. But when you involve a bunch of people, it just prolongs the process. Follow up with community partners was sometimes challenging. They're doing this outside of their jobs a lot of the time. And so it can be a little bit of a challenge to get feedback in a timely manner. And then the other thing is, this was, I think, a challenge in itself, synthesizing a lot of ideas. People had a lot to say, and we wanted to make sure every voice got represented in the final project. However, I think this really speaks to the spirit of community engagement. They help. Without our communities, we would have zero data. And so I think it's really neat that they get to be a part of one of the finished final products that communities are generally and typically not a part of. And so I think that speaks to the spirit of COSEAL, that, we're not just getting data from these communities and then say, okay, we're going to run with our stuff. We're actually involving them in here. It's a really neat paper. I think it's more well-rounded, has some notes in there that I don't know if we would have thought of without our community partners. And I think it's also beneficial for readership. I think some people read these articles who maybe are less familiar with academia. And so I think this really speaks to a couple of different points, whether you work in academia or not. I think the slide might, this is recorded. Just here's my email if you have any other questions. And I think it's time for me to pass the baton to Charlene.
Perfect. And we can put emails in the chat too if there are questions. We welcome people reaching out. Welcome, Charlene.
Thank you. I just want to highlight one step in that whole process. When Zach shared the paper out to the folks who came in and did give feedback and were part of the meetings, we looked to see what voices were missing, and we went back and we made sure that all communities were represented. Just so you know, that was also important for us. So hi there, this is Charlene Barrientos Ortiz. I have about 10 minutes to cover these slides. I am very open to having conversations at the end of this dialogue or this presentation with folks offline. I will also say that I do hope that the organizers, they've talked about going back to in-person. I would have loved to have been in person with everybody here. So next slide. So, when I was asked to be a presenter, I really thought about, what does that look like? What is it, when we talk about data and data sovereignty and all of the elements about just data, there's so much as I think about in my work and over decades. Like, what does that mean to different people in different places? In academia, it does mean oftentimes data collection and then manuscripts, right? That's part of it. But in my work and working with folks, it's somebody's story, right? So here on the left hand, you see cells, but they were somebody's cells. And I'll talk about that in a minute. But there's somebody's stories, and they're part of people's networks. So I'm a visual person, and this is how I see data. And I know that oftentimes we see labels and we see diagrams and we see graphs, but I see people, right? So next slide. So data is more than charts and figures. I do put these slides together, but then I forget, I'm going to talk about that next. And I want to talk a little bit about the consent and what people are agreeing to. Even right now, if we download an app, before you can actually use it, you have to agree to all these terms. When I look at consents and in the area of health research or research, we have to really consider what we're asking. And we talk about grade level and readability and all of that, but really it is really important for us on either end, in community or in academia, to pay attention to what we're asking people to consent to. It's really important for communities to know that who owns that data. And while we say, you know, there might be a little bit, yet you do own it, and you're consenting for us to use it. But the bigger question is then, where is it housed? What's the access? So I'll get to that in a minute. But before I do, I wanted to share that these are people's stories. And as we listen, you know, we have a training program, and it's called the Colorado Immersion Training. And just this year, we were in Southern Colorado, and we heard from somebody who shared, I was a part of a research project, and we didn't get the results back. And this was a group of folks from the community. And while we were not, you know, we were there and I was part of a team, we were not the folks who were part of the research team then. We are part of an institution, and we feel like we need to be a part of at least trying to get them their stories back, their information back. This was a health study. And so sometimes we walk into as research teams and researchers, and I am representing CU today, but I also am giving you community stories and what we hear, right? And so, and I am also part of many communities here in Colorado. I'm born and raised here, so it's important for us to have that, have those voices at the table as well. But I want to share that it felt so, it was a very interesting place, because when we are research teams and we are partnering with community, or communities are in their own community and they want to partner with institutions or researchers, we have to be really authentic about what that looks like. We talk about partnerships, but what does that really mean? And you know, funding dictates a lot of what happens. And I want to share that I know that people want to have these conversations, but we also have to look at reality, right? There's the good, the bad, and the truth. And we have to talk about the truth and what that really looks like. Regulations oftentimes can be roadblocks for us. But here's what I wanted to share. For engagement to succeed, and this is from the principles of community engagement, that partnering with community is necessary to create change and improve health. There was a question in the chat about regulations and not always, you know, paying attention to these cultural overlays, or, you know, the context of the culture. So I want to be real about that. I want to point that out, that as we look at partnering and true succeeding, you know, success and looking and moving forward, these are conversations that don't have to be hard. But if they're not talked about early and often, they will come later if you're really partnering and authentically partnering. And again, looking at community and listening to those cultural overlays in context, including in a consent. So I'm leaving this there. You'll get a copy of these slides, and there's the source there for community engagement principles. I'm speaking really to folks who are new in their career in academia. I really believe that, you know, when folks start, we don't get this kind of introduction. Lots of times people, as they would call it, you know, it's baptized by fire, and it doesn't have to be that way. I think there are a lot of different ways that we can look at partnering, and it's an invitation. It's an invitation to do better and to move better with each other and then with community. So next slide. So when we talked about data, you know, the storage, and this is if, you know, you're doing focus groups or you're doing surveys, or even qualitative data collection, you know, where's the storage? How is it being accessed? And more importantly, what is the message and interpretation of that data? I use that word data because, you know, it starts with somebody's story. It starts with collecting somebody's information, and it also ends with messaging. And that messenger matters. I'm working on a couple of projects right now. We have a lot of data, so we have a lot of work to do with folks. Is there an agreement? You know, where is it kept? And if that hasn't been asked yet, you got to go back and ask that question, because lots of folks don't even know what that could look like and what it should look like. And again, I know we're about regulations, but there is also, we look at community and institutional regulations and protocols, but there are also community protocols, and that's transparency. So we talk about access and gatekeeping and roadblocks. I will share with you a little bit of a story that is part of a community or academic and community partnership that I was connected to. The community partner wanted their community leaders and gatekeepers to do some of the interviewing, and these were qualitative interviews, and which makes sense. They had, direct access. They were the right people. They could hear those cultural overlays and help interpret the data later. And the response they received was from the academic side was that IRB, there is a training that goes along the city training, and I'm 100% there. Let me tell you, if you do, you make shortcuts on community, you cut the community short later. So I'm a big fan of training and making sure that people have what they need to be successful in the field. But I will also say that the message the community person heard was that that IRB was going to expect too much from the community folks. That made the community person feel like they compromised. That's a whole other conversation to have, but what are the compromises around who makes these decisions, and what that looks like? Again, I do believe in training and setting people up for success, but I also have been in academic settings where people will hire folks and data collectors, and they don't have that community experience. They don't have that community way of being. And so then I'm curious and I wonder, was it just really about collecting the data? So expectations for the academic side in publications and data is, Zach's right. It's about publications and manuscripts. It's about conferences and presentations. I would invite people to make sure that as that whatever you're collecting in whatever way that you're collecting, that you invite people to at all of those steps. I think Zach gave a really good example of what works or what's working right now, and it's one way, but also in those manuscripts and conferences and presentations to make sure that the academic is not always front and center, but really the people who are on the front lines collecting that information. If they're part of a study team, making sure that your study team looks like or has experience working in community. So community also wants to know why and why not. It's their story, who decides when, how, and who will share. Like I shared, we have a lot of stories that we have a lot of work to do. And I will go back to what Allison said about in projects that budget significantly or think about time and what it's going to take to include your partners. It's important. It's not only important, but it's the right thing to do. And then, that's a whole other conversation about ethics. And hopefully that will come up at a future talk. So I'll go to the next slide, please.
Sure.
So I did touch about this a little bit. Research protocols, they can be roadblocks. They can also protect the academic on the academic side, but it's meant to protect communities. So let's look at how we use them so that they can protect and set folks up for success in telling stories. There's a picture here of the immortal life of Henrietta Lacks. Those were the cells, the picture of the cells in the slide that I was sharing. If you don't know about Henrietta Lacks, I invite you. That is foundational for me when I'm working with anybody, both in academia and in community. It is really important. This is not something that happened, in somebody else's lifetime. This is the truth. We still have HeLAC cells here, and we have benefited greatly from this woman, and we need to remind ourselves that this is the story of research. So actions make a difference. You know, we have a lot of policies and regulations and protocols, but if there isn't information, if there isn't true partnership, if there isn't really looking at what that looks like, and we don't talk about dissemination and messaging and who they are, then we're missing a lot here. Data, you know, I will go back, and it starts off as data, but it's somebody's story. And that interpretation of data, the message and the messenger, it matters. Ethical, engaging, respectful partnerships can be long-lasting, but if you don't have that, maybe this is not, you know, maybe this is not the field for you. I'll just be authentic about that. And if you continue to do that, then, you know, that's a whole other Oprah that we should be having a conversation about. But protocols, agreements, and action mean a lot to community. So I'm going to go to my last slide because I really want to, you know, I'm going to go straight to recommendations. There's a lot of good folks working in community and really looking at engagement and looking at all of these pieces and how can we do better, right? And I'm talking about this as a whole body. I'm, you know, I've shared this with the organizers that I believe that there should be an in-person roundtable to have these discussions and put these topics on the table and have it open and let people come and have, you know, it will be a learning opportunity. This is not about lessons learned. This is about how we can move and how we can do better and how we can learn from each other. So that's, you know, that's my call to action. But research and community partners, I will share, I put folks here, so this could be on the academic and it can also be in the community. But I will share with you that community shows up and they'll show up. They can be very generous with their time. I know we're at time, so I'm going to just do these real quick. They can be very generous with their time. I have a saying when I work with folks, and if you work with me, you will have heard this. I believe in fair, not free. Because free, we will always give that and we will show up, but it's fair, not free. And if I get paid and I'm meeting with somebody, they get paid because it's our work together. Interpreting of data as part of the dissemination process. That starts way at the beginning when you're looking at the consent form. Talk about dissemination at the beginning of the project and keep talking. It is part of the story. And then share back the data in various formats. Don't be afraid to do that. Publications are beautiful, but they're not always shared, right? And then when dissemination's finding, it's somebody's story, and whose story are you telling? If you're up there giving a presentation and you don't know some of these things and you don't have that cultural context, you might need a co-presenter there. Or if you're in community, right? And supporting somebody else. And then last, I'll go back and say the immortal life of Henrietta Lacks and the HeLAC cells. It's so important. We have a lot to learn there. We have not arrived. We have a lot to do, but we are going in a good direction. So I'll stop there.
Thank you so much, Charlene and Zach and Allison, for really giving us a 360 view of data sharing and the many ways we can approach, I think, a really important area. We don't have time for Q&A, but we've had, I think, a really rich discussion in the chat today. And if you have other questions or thoughts, want to chat with us and our speakers, we will be on for a couple of minutes. We welcome that, but I want to honor everyone's time and just say thank you. We hope to see you again in January.